The topic of the video today is primary biliary cholangitis. So what is primary biliary cholangitis? Primary biliary cholangitis, which is also called as primary biliary cirrhosis, is an autoimmune disease that affects the liver by damaging its bile ducts. These ducts are essential for digestion, carrying bile from the liver to the small intestine. When the ducts are blocked or damaged, bile builds up in the liver, causing scars and cirrhosis. So, what's the etiology? Primary biliary cholangitis is an autoimmune disorder where the T cells mistakenly attack the bile ducts in the liver. Risk factors for PBC. PBC predominantly affects women, with 90% of cases occurring in females. It most commonly occurs between the ages of 30 and 60. A close family member with PBC increases the risk. Smoking and certain chemical exposures may also play a role in the development of PBC. So, what are the symptoms of PBC? It mostly develops gradually, sometimes without symptoms for many years. If symptoms do appear, they can include sudden fatigue, nausea and vomiting, unexplained weight loss, skin darkening or yellowing, that is jaundice, and intense itching. So, the diagnosis is based on medical history and physical exam. Review the medical history and conduct a physical exam and assess symptoms. As far as blood tests are concerned, a key initial step is testing for antimitochondrial antibodies in your blood. Also, elevated liver enzymes, especially gamma glutamyl transferase and alkaline phosphatase, along with AST and ALT, may indicate liver inflammation and damage associated with PBC. Imaging tests such as ultrasound may be ordered to examine the liver and bile ducts for abnormalities. If PBC is suspected, a liver biopsy may be performed to confirm the diagnosis and assess the extent of liver damage. So, for treatment, we use medication such as ursodiol, which modifies bile composition and improves liver function. For symptom management, we can use antihistamines such as diphenhydramine for itching, and also cholestyramine is used to relieve itching associated with PBC. We give vitamin supplements to prevent deficiencies and manage side effects like osteoporosis. Finally, in advanced stages, a liver transplant may be necessary, offering a significant improvement in life expectancy. However, PBC may recur, typically progressing more slowly after transplantation.